Welcome back. It's March 28th, 2026. Today, we're covering major FDA breakthroughs in rare diseases, a new COVID-19 variant being tracked globally, and a massive study on meningitis that's changing how we look at global health. Let's dive in. 1. Major FDA approvals and rare disease breakthroughs. The FDA has been busy this week with several high-impact approvals. Gene therapy for LADI. The FDA approved Kresladi, marnetegravir autotemcel, for pediatric patients with severe leukocyte adhesion deficiency I. This is a life-saving first for children with this rare genetic immunodeficiency. Hunter syndrome. A new treatment, Avlaya, was approved to address the neurological manifestations of Hunter syndrome, MPS II, providing a new option for affected families. Ovarian cancer. Lifurli, relacorilant, received the green light for use in combination with nab-paclitaxel for patients with platinum-resistant ovarian cancer. 2. Global health alert. The cicada variant. Researchers are now tracking a newly identified COVID-19 variant, BA.3.2, informally dubbed cicada. Presence. Detected in over 20 countries so far. Concern. It carries a high number of mutations in the spike protein, which may reduce the effectiveness of existing antibodies. Good news. There is currently no evidence that it causes more severe illness than previous strains. 3. The global burden. Meningitis and tuberculosis. Meningitis study. A comprehensive new assessment published in The Lancet Neurology estimates that over 250,000 people die annually from meningitis, with children in Africa being the most vulnerable. TB success in India. India continues its remarkable turnaround, reporting a 21% drop in new TB cases over the last decade, one of the fastest declines among high-burden nations. 4. Research highlights, lifestyle and prevention. Weight loss shortcuts. A new study suggests that dietary repetition, eating similar meals daily, can lead to better weight loss outcomes by reducing decision fatigue. Heart health and exercise. Research from Medical News Today shows that just adding 5 extra minutes of exercise and 10 minutes of sleep daily can significantly lower your risk of heart disease. Stress and metabolism. New findings emphasize that daily stress causes sharper glucose spikes in individuals with insulin resistance, making stress management a critical tool for diabetes prevention. 5. Medical education and policy updates. India focus. NMC deadline extension. The National Medical Commission, NMC, has extended the application deadline for new PG and SS courses for the 2026 to 27 session to April 22. Karnataka penalty. The state has implemented a 50 lakh rupee penalty and a mandatory 3-year government service bond for PG medical students. Liver cirrhosis. For patients with liver cirrhosis, a validated machine learning model using available clinical and laboratory data can accurately predict the risk of hepatic decompensation. American Journal of Gastroenterology. MedPage Today. Keep your car windows up. Breathing in outdoor air pollution, including diesel exhaust and fine particulate matter, may increase your risk of lung cancer. Fine particulate air pollution is strongly linked to cancer driving and cancer-promoting genetic changes in lung cancers of people who have never smoked. The best way to protect yourself and your family is to keep your car windows rolled up when driving, especially on roads with heavier truck or bus traffic. WebMD. Brain fog. A lack of B12 may lead to depression, confusion, memory problems, and dementia. It also can affect your balance. B12 supplements are usually safe. For adults, doctors recommend 2.4 micrograms a day. If you take more than what you need, your body passes the rest out through your pee. Still, high doses could have some side effects, like dizziness, headache, anxiety, nausea, and vomiting. WebMD. The ACC.26 era. We're currently in New Orleans for ACC.26, March 28th to 30th, 2026, where thousands of experts are redefining how we treat the heart. The big news: the field is shifting toward data intelligence and AI-driven workflows, with companies like GE Healthcare showcasing deep silicon photon counting CT to see heart structures like never before. Major clinical trials, heart failure and valvular disease. Early intervention. A 12-year follow-up of the recovery trial just confirmed that early aortic valve replacement for severe asymptomatic stenosis is significantly better than waiting for symptoms. New drug pillars. Finerenone, from the FINEARTS-HF trial, is emerging as a second pillar for heart failure with preserved ejection fraction, HFEF, alongside SGLT2 inhibitors. Mavacamten for teens. Fresh data from the SCOUT-HCM trial shows mavacamten, Camzyos, effectively treats symptomatic obstructive hypertrophic cardiomyopathy in adolescents. The lifestyle bombshells, screen time, and ultra-processed food. The 6-hour rule. A major study presented this week reveals that young adults, average age 35, spending 6+ hours on screens daily outside of work have significantly higher blood pressure, bad LDL cholesterol, and BMI. UPF warning. Consuming more than 9 servings of ultra-processed foods daily increases the risk of a major cardiac event by a staggering 67%. Morning exercise. New data from 14,000 Fitbit users suggests early morning workouts provide better protection against CAD and obesity than later sessions. New 2026 guidelines, dyslipidemia and women's health. Earlier screening. The 2026 ACC/AHA dyslipidemia guidelines now recommend lower LDL-C targets below 55 mg per deciliter for those with moderate atherosclerosis. The reproductive risk marker. A new 2A recommendation urges doctors to use history of preeclampsia, gestational diabetes, or early menopause before age 45 to personalize heart risk assessments. Hypertension rise. A sobering update shows hypertension-related deaths in young women, ages 25 to 44, have risen fourfold over the last 2 decades. Prevention surprises, shingles and vaccines. Shingles vaccine power. Adults over 50 with existing heart disease who got the shingles vaccine were 46% less likely to suffer a major cardiac event within the first year compared to those unvaccinated. COVID-19 vaccine clarity. A large population study published this week found no link between COVID-19 vaccination and sudden cardiac death in healthy young people, debunking persistent myths. Closing. Stay informed. That's your medical wrap-up for today. If you found this helpful, hit that subscribe button for daily updates on the science and policy shaping our health. Which of these stories surprised you the most? Let me know in the comments below. Don't forget to like this video and subscribe for your daily medical news update. Stay healthy. Disclaimer: this script is based on general medical information and does not constitute personal medical advice. All information must be verified before use. The creator, publisher, and YouTube will not be liable or responsible for any negative consequences.